Hello guys, today we'll be discussing infertility. What an interesting topic we have today on our hands. Now, what is infertility? Infertility is the inability to conceive after a full year or 12 months of having regular intercourse with your partner, which medically we say having regular intercourse means having intercourse at least 4 times a week with your partner. Now, many people are actually out there not infertile, just that they do not know how to time it right. Remember guys that every month you have only 1 day to conceive, meaning in 12 months you have only 12 days to conceive, meaning in the 365 days a year you have got only 12 days to conceive, and that is the day that you ovulate and it's your fertile days. In a video I talked about the safe days, the fertile days and all that, but fertile days comes only once in a month for a woman who is absolutely normal. When is that day? Well, you need to know the interval from one period to the next. Let's assume the period from one interval to the next period, like this period to the next period, you have about 30 days. We usually subtract 14, we remain with 16, which means that you ovulate on day 16. So if you ovulate on day 16, how do you reach the day 16? Well, the day you begin bleeding, you count that as day 1, day 2, day 3. Most ladies will stop bleeding on day 3 and 4, others even 5, but keep on counting day 6, 7. Now, when you reach on that day 16, that's the day you ovulate. However, after ovulation, the egg takes only 1 day and it degenerates or breaks down. For that reason, you need to have or meet with your partner at least 3 days before your ovulation day. So someone who is ovulating on day 16 would probably have to start having active intercourse on day 13. Now, also after having your intercourse, after the man has reached orgasm, ensure that you stay with your partner in situ. I mean, in that position, the partner should not leave you immediately after ejaculation. This ensures that a large quantity of the semen crosses the cervical os, or the doorway to the uterus, which is very tiny, without most of them dying through the vaginal cavity or the backflow of the semen. Well, basically, that is how you can maximize your chances. So remember to know when your fertile days are before you complain about infertility. You're most welcome for this video once again. I'll be back in a jiffy. Well, now, infertility, there are basically 2 types. We have primary infertility and secondary infertility. Primary infertility, we are talking about those who have never conceived in their entire life. And then when we talk about secondary infertility, this is infertility whereby someone first have a child or even 2 kids, then in the future or later time in their adulthood, they fail to conceive. Now, basically, both are common. But what worries people the most are primary infertility. Now, for the purposes of this video, I'm going to divide the causes of infertility into 3. We have the tubular problems, we have the hormonal problems, and we have the brain problems. So when we begin with the tubular problems, this is basically usually due to blockage of tubes. It's the most common cause of infertility. Now, what causes these tubes to be blocked? Infections. When you get any vaginal infection and you delay to treat it, you can end up with infertility, because when the tubes are blocked, there will be no passageway for the semen to flow, which of course contains the sperm cells and reach where the fertilization is going to take place. That's 1. 2, what causes the blockage of the tubes anyway? I said infections when you take long, but the most common cause are miscarriages, as the layperson calls it. Medically, we call them abortions. Miscarriages and infections are the top leaders of causes of blockage of tubes. So sometimes only one tube is blocked. In most cases, usually both are blocked, but sometimes only one is blocked, and usually they can be flushed and opened. Then you get treated and you, of course, conceive. However, we also have some other forms of problems to do with infertility. That is hormonal problems. Hormonal problems usually happens when you're having issues to do with the ovaries or problems originating from the brain, but usually some infections destroy the estrogen receptors, which is hormones that controls or make the smooth flow of your reproductive cycle to continue. So if the cycle is interrupted, whereby the estrogen receptors are destroyed by either infections, trauma, I mean things to do with accidents and so on, you are also likely going to have challenges with conception. We have conditions like ovarian cyst, okay? We have conditions, ovarian cyst, watery fluid-filled vesicles forming around the egg or the ovary can also affect the receptor of the estrogen, which is a hormone that is very essential for you to conceive. So basically, we also have other causes that can be originating from the brain cancer, brain tumor. Sometimes there are just some lesions that affect the normal functioning of the brain that would contribute to you conceiving in the normal way. So basically, these are some of the things that could cause you and make you fail to conceive. Now, various things that I have talked about, they can all be managed. That's the beauty. Except a few, maybe you have a brain tumor or cancer in your brain that's affecting the release of these hormones. That can be what? We may have challenges with that. And then we have certain drugs also can affect the hormonal problems and all that. So basically, all these conditions can be managed. I just wanted us to know the major causes of infertility. So how do we handle them? They all have different treatments. Hormonal problems, we have medications that can stimulate you to start ovulating again. Okay, and then when it comes to the tubular problems, I talked we can be flushed. Others requires actually surgery. And then, yeah, basically that's what I can tell you about infertility in brief, and that's female infertility. Guys, you remember to like and subscribe. Also, I would like to extend my sincere appreciation to Christ the Center Media Production for the wonderful work they have been doing in helping us to produce this video. Big ups. Have a blessed day. I wish you good health from Sydney Medicals.